Hi guys, welcome to week 3 of the Family and Addictions course. We're now moving into this concept of assessment and intake and really looking at gathering data from families and from clients to be able to help start to put some strategies together for treatment. So I just wanted to talk a few minutes today about assessment in a general sense. Now I know in the textbook you're reading about a very specific assessment, the Clinical Family Addictions Assessment Interview. It's a step-by-step process for gathering information from clients and families, and I think it's a very good one, so it's a good one to learn about. But I think it's important that we talk about assessment in general, what the purpose of assessment and intake would be. Now we're talking specifically about substance abuse clients, but this would certainly be true for mental health clients as well. We can really look at this process as just being a really simple 3-step process. We've got assessment, which we're gathering information. We're gathering all this information about clients and their families. We're trying to figure out what's going on, identify some presenting problems, and then we're moving into using that information to make some sort of diagnosis, or at least come to some conclusions about what the presenting problem is and where we need to go with it, which is the treatment part. We use the data that we gather, the diagnosis that we come to, we use that to help us formulate treatment plans. So there's really that 3-step process there to keep in mind. So it's not really as complicated as we want to make it sometimes. We're really doing 3 different components of that. Now, some of the first things that we need to do is to gather that data. We need to make sure that we are doing that in a way that is consistent throughout the process. Now, sometimes we think about assessment and intake as being a one-step process. We gather the information, we fill out the forms, and we're done. But one of the most important things to remember in this process is that assessment and intake happens throughout the whole process of counseling, treatment, and even through termination. So assessment is a way of assuring that what we're doing on an ongoing basis is working. So one thing to think about is way to think about this is think about it in stages. So early assessment, middle assessment or treatment level assessment, and finally that closure assessment. And the first place to start is with that early assessment. Obviously, when the client walks into your door and their families walk into the door, you're going to have to start gathering information. Now, depending on the agency that you work at, that may be required on specific forms, or there might be very specific ways that they gather data. It may be through formal, informal procedures, which we'll talk about in just a second. But either way, assessment follows kind of simple protocols, and one of those is to determine how you're going to gather the data. Is it going to be formal or informal, like I mentioned before? Formal assessment gathering is testing using instruments. It's objective data that you're pulling together. You know what that it is based on. It could be statistical reports. It could be based on assessment and clinical information that you get from your forms. Informal data is going to be that client self-report, some collateral information. We call the information that we get from families and that we get from their employment places outside of the client. We call that collateral information. It's information that we're gathering to help us build kind of a case to determine what's going on. So we want to gather information about the nature of the client's problems, the severity of the client's problems, and very important, especially in substance abuse, is what is the impact that the stuff that's going on in the client's life, what is the impact that it is having on the client in their lives, in their social lives, in their occupational lives, but in their family relationships as well. And so remembering that this is going to be ongoing assessment. So while you may gather this information from family and from the clients, initially, it is something that you want to keep revisiting throughout the treatment process. 5, 6 sessions into the family, working with the family, you're still going to be assessing progress and maybe using some of these formalized instruments to as a way to mark progression in the treatment process. I mean, if you use something like the SASE, or if you use something like the Beck Depression Inventory, you can use that multiple times throughout the treatment process to see how those numbers change, because obviously if the numbers don't change, if the If there's still high levels of depression or substance abuse and things of that nature, then what you're doing is not working and you want to change course. Measurement, assessment is one way to assure that what you're doing is working. So that's another good part of that. Another thing is to assess general background. You can use closed-ended questions to do general background things. That's where you're gathering facts. But you also want to be gathering information for diagnosis with open-ended questions. So what brings you in? Why are you seeking treatment now? Tell me more about what you're seeing with the person that you're here with. So if you're working with families, and that's a good place to kind of get a sense of how truthful and honest the identified client is going to be with you is when you're starting to talk to those collateral contacts, because they oftentimes have a different version of what's going on than the client. The client oftentimes in addiction will minimize their behaviors and their symptoms and the impact that they're having on the family. So you have to really gather information from multiple sources. You want to get mental health history. Even though you may be focusing on the substance abuse, you definitely want to gather a mental health history, not just of the client, but of the family as well, and substance abuse histories of the family as well. Social histories, any medications that are going on, risky behaviors, suicidal behaviors, legal history. You're going to see a lot of legal history with substance abuse clients. Oftentimes they get DWIs, public intoxications, other disorderly conducts, and those types of things. They may have current legal issues going on as well, and especially within families. If there's a substance abuse problem and if there's things like divorces or separations going on, you may see that there's some custody problems and issues going on there as well. And so those are the types of things that you want to really start to kind of pull together with assessments. Now, another thing to think about too is that you want to gather that information, like I said, is from many sources as possible, and you want to help. That's going to be something that when you're gathering this information is going to help you develop those treatment plans. And so one of the things that we tend to do in assessment and diagnosis is that we really focus on the problems. We focus on the weaknesses and the worst side of the client. So one of the things that I really want to encourage is that you also find out what are the client's strengths in this assessment process. What are they doing well? What talents do they have? What coping skills do they have? What resiliency skills do they have? How have they been able to manage and function even in the face of this dealing with this disease? Because that is going to be really important to help them see this that they have the capacity to get well, and it can help instill more hope and empower them. You got to be non-judgmental. You got to find out what the motivation there is for the client. You got to find out what the change techniques that you're going to need to use by gathering this information. Because with substance abuse clients, I very rarely have seen somebody walk into an office, especially when I was as a counselor in the substance abuse treatment center. Very rarely did any of my clients walk into the office, sit down and say they were there on their own accord because they wanted to stop. In all honesty, substance abuse clients tend to be in your office because there's some heat on them from somewhere, whether it's a court, whether it's families, whether it is their employment. There's something that is compelling them or propelling them into the office to kind of take care of that. And it doesn't mean that people can't come. It doesn't mean that they don't have a desire to want to stop using. Most likely their desire is they want the heat off of them. They want things to be better and they want to feel better. And they don't necessarily connect that to stopping using the chemical as being the first step to getting on that path. So you gotta help them see that the alcohol and drug addiction or other types of addiction that they may not be involved in are directly related to the problems that are going on in their life, and that is part of that assessment process, is helping them get involved in that. So assessment's really important, not only in mental health but also in substance abuse treatment. It is important because it gives you that starting off point. Where do we go next? Because the next part is now you have to make a diagnosis, and part of this diagnostic process is that you really need to be able to have this really good information, and it needs to be a mix of the objective and the subjective. So interview and report is good, but you do need to back that up with objective instruments that will help solidify some of your conclusions. And of course, that diagnosis, like I said, will lead you into treatment strategies. Of course, treatment strategies will be some of the things that we're focused on next week. There's a few hints in the textbook about that. But we're going to focus on what are some of the good strategies for working with families and the addicts next week. Now, I just wanted to remind you that your journal article critiques are due this Sunday at 11:59. And by the way, I guess you probably saw the announcement I put into the classroom that I graded all of the reaction support group papers. They were very good, and I gave some comments on that in that announcement. I will say that, as I said in the announcement, that most of the points deducted had to do with writing and APA errors. So I did link the OWL, which is a great website resource for APA, learning APA. So if you got some points taken off for APA, go and review that site. Even if you didn't get the points taken off and you did APA well, that's a great site to reference down the line. But the journal article critiques are due Sunday, 11:59. I think the syllabus does a good job of outlining what I'm expecting from that. And you should be working on your family group projects. We're really only about 2.5 weeks away from the end of the semester or end of our summer session, so it's coming up quick. So you want to make sure that you are working with your family group, your groups, to put together these family lectures and these family presentations. And I've created those spaces for you guys to be able to communicate with each other just in your groups. So if you have any questions about that, you can certainly email me. If you need to talk to me by phone, we can set up phone times to talk. We can even Skype and things of that nature. So I'm here if you have questions, and I hope that you have a good week. Bye-bye.